This is Isolo, a community of grassroots citizens on Lagos mainland, vast in trade and deep in business activities. Increase in population here is good for economic activities, but not without consequences. Dealing with health challenges at the primary level is a daily battle most households try to contain at a time the economy is biting. Janet Olaniyi is a fashion designer who worries about the health of her 4-year-old son. Help has finally come with free medical treatment in Isolo as a new health center comes alive.
Free education. So, but our food ben no. Àwọn èèyàn tó bá wá sí ìgbà náà, wọ́n wá fún pé kí ìlera lè ṣe kíni. A mọ̀ pé ló dẹrùn lọ́wọ́ yìí, but mo advice àwọn èèyàn kan tọ́jú ara wọn kó jẹun lásìkò. Kan lóògùn lásìkò.
Lagos State government now here to attend to the health needs of those living in Isolo with a promise it will go around. Health professionals drawn from the Ministry of Health are on ground to make this happen. The state government and Eco Club International work as a team for free health mission comprising of free medical treatment for various ailments in Isolo local council development area of the state. Dr. Jide Idris is the Commissioner of Health for Lagos State.
We are looking to employ more staff within limits of resources available, but more important, to alleviate that again, we are partnering with the private sector because that private sector is providing health service to a huge percentage of the population. So we need to partner with them so that we can increase access.
He said the state is quite prepared for the influx of people into Lagos, putting high pressure on its health facilities.
We do realize this, there's influx of Lagos. Like we always say again, we are we are being besieged by people left, right, center from different aspects of the country, even outside the country, to come to Lagos State. The government is very much aware of that, and all efforts are geared towards improving on the access of the people to health care. And that one has to do with building more facilities. We are right now renovating all our facilities at secondary and primary care level. We are going to do them in phases, and that renovation also involves equipping them so that I think they can continue to provide those services.
He seems confident that Lagos is up to the task of providing quality health service.
We'll soon launch our health insurance scheme thing. We're going to start the sensitization program. And this is another way again of ensuring access, financial access, physical access to the people of Lagos State. We do realize the enormity of the problem, and I can assure you that the government is committed to addressing these issues. And that's why we appeal again to members of the community. Government cannot do everything all in one fell swoop. We need support of good-spirited people of Lagos State.
With medical experts drawn from the international community, the government says nothing can go wrong. This is Dr. Bukola Shuaga, a medical doctor based in the United States. Her love for her country won't let her stay back. She's part of the team here to make things work.
Okay, so Lagos is the most populated state in Nigeria, and so a lot of people come to Lagos every day, and so I think really what we have to do as far as, changing health and making health better, it's all about education, education, education. People need to be educated about the things that are going on in their country, things that can happen to them in their health, things that can affect them. A lot of the things that make people sick can be prevented. So if the people go to the doctor regularly, then that can help them out. Okay, if they eat healthy, if they exercise, if they're aware of things like malaria. The way you protect yourself from malaria is you try and use some type of insect repellent so the mosquitoes won't bite you. And then as far as cholera, you just have to try and drink from clean water sources the best that you can. So I would really just say education, 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 education in the schools, education maybe on billboards, word of mouth. That's really what it is. Health is all about education.
Pretty good news for residents of Isolo.
I think it's really important that the people, of course, they have to pay attention. They have to take these things serious, okay? Because there's a lot of diseases out here that are killing people that can be prevented. So you really just have to pay attention to yourself, and you have to love yourself enough to take care of yourself. Think about your loved ones that will be worried about you if something happens. So you really just have to pay attention and listen and take things serious. Like I said, they're trying to improve the economy, they're trying to improve the health in the state itself. But of course, with any country, you know, there's always ways that you can improve the health of the state. So I think really to improve the health of the state, like I said before, they need to, I think the government itself should be the ones trying to educate the people of Lagos about how they can better take care of themselves and how they can better make sure they're healthy and that their family is healthy.
Doctors here are motivated by the state government to ensure providing quality health care for Lagosians becomes a consistent reality, a reflection of what the Isolo Free Medical Initiative is all about. Dr. Dolakbo Fashawe works for the Lagos State Ministry of Health. Together with her team, the effort to carry out government's agenda is fundamental. She is the Lagos State coordinator of the Eco-Free Health Mission. She explained that this is a mission of hope in the overall health interest of Lagosians, especially the rural people, with Isolo taking the lead.
Lagos State, as we know, is a mega city by all standards. And in every mega city, there's limited resources and very high demand. There's absolutely no tribe of Nigeria that is not represented in Lagos State. Now, when all these people come together to access our health care, it then goes without reason to say that the demand far outweighs the supply. But this government, being a very proactive government, is constantly looking for ways to meet this demand without abandoning its primary responsibility to make sure healthcare is affordable, it's accessible, and it is sustainable.
She feels government cannot do it all alone. Her words for residents who care to listen.
A healthy people is a healthy nation or a healthy state. The responsibility does not rest on the government alone. There's a big responsibility for the citizens of the state, for the visitors into the state, for the residents of the state. If you don't do what we advocate, if you don't do what we advise you to do, all of this will be a waste. As we have said, health is wealth, but the responsibility does not rest on the government alone. It is absolutely impossible for the government to do it all. Even in developed nations, people are talking about Obamacare, people are talking about NHS. Here, we are asking the people to help us make the state a healthy state. And you will then say, how can you help us? We preach health education, we preach healthy living, we preach healthy lifestyle, we preach good health-seeking habits. As everyone has said, the responsibility cannot be left to the government alone. It cannot be left to the doctors alone. It cannot be left to the nurses alone. Mothers, fathers, children, students, teachers, it is a collective responsibility. Our health is our wealth. Let us protect our health the way we protect material possessions. Let us do regular health screenings. Let us check our blood pressures. Let us check our blood sugars. The same way we don't put bad petrol in our cars. Let's eat healthy. Let us not feed our bodies with narcotic substances, with cigarettes, with alcohol. Take care of your health. It is your future. It is your legacy. As a matter of fact, it is all you have.
She says this mission is to help the people and satisfy the health needs of the less privileged.
One of the projects of this administration is the Eco-Free Health Mission. And what we do is we take free healthcare to people in the grassroots. We take it to people where they live, we take it to them where they work, we take it to them where they go to school. And the objective of this program is not only to treat sick people, we also aim to reduce the disease burden of Lagos State. It will then go without reason that if more people are prevented from falling ill, then the burden on our healthcare centers will be reduced. In this project, we have 6 departments. We believe that prevention is better than cure. It's a common adage, but in medicine, it is very true. We educate people on how to keep themselves healthy. Malaria can be treated with medication, but malaria can also be prevented. In essence, the burden is very large, the demands immeasurable, but every responsive government is constantly looking for ways to meet these demands and help alleviate the suffering of its people.
Zainuddin Popola is the president of Eco Club International.
What I've seen in Lagos, people don't take good care of their health because of lack of education. Number one, in terms of smoking, drinking, all these things cannot be accomplished. People need to stop doing such a thing. If you take care of your body, you exercise, you eat well, and eat a proportional food, and once they do that, everything will be okay. The government cannot do it all. People have to take the responsibility of their own for their own good health. I've always tell our people, I'm from Lagos, and I believe there's nothing we can do in the United States except to bring something back to our people. But we have to do it through education. And what we encourage our people is to stop smoking.
For the Oba of Isolo, it is left for the people to take advantage of this opportunity.
My Isolo community people, you have here now a befitting health clinic. Always check your blood pressure, check yourselves, come to the clinic. You have the opportunity. The drugs there are free for you. So do come and always appreciate those who give us this opportunity.
For the state government, the plan is to reach as many Lagosians as possible, working together with Eco Club International to provide a team of doctors, nurses, nutrition experts, and certified diabetes educators to raise awareness and make Lagos a safer place for everyone.